Assalamualaikum doctors. In this video I am discussing about a history, that is a recall history. Recently also come, that is a non-accidental injury history. First, from these pictures what we find, non-accidental injury, some features we find like inconsistent history, social circumstances. So the history is like inconsistent history and social circumstances. There is social family problem present. The mechanism of inconsistent with injury. Delayed or multiple presentations, multiple soft tissue bruising. There is bruising present and delayed of multiple presentation. Delayed presentation, they come later in hospital. Then SDH, bilateral retinal hemorrhage in a child. So eye bleeding, eye hemorrhage. Multiple fracture, rib fracture, multiple metaphyseal fracture. Atypical unexplained injury. So the injury, how happened, why happened, that is atypical history they are giving. Now, chief complaints of non-accidental injury is that 5-month-old infant, mother has 3 children, divorced from first husband. Second husband died during COVID. This infant came irritable since yesterday. Has bruises on face and cheek. Swelling of the limbs was clear abuse. She is leaving him with her friend. Okay. So this is the chief complaints. First we will analyze complaint. So if rash is chief complaint, onset, course and durations, describe the rash. Distribution, is it elevated, is it itchy, does it disappear when you press on it? Different shape, size, color and distribution, especially back or buttock. Napkin rash, how frequent you are changing diaper. So there is a rashes, so rash we will analyze, and especially the back and buttock rash and napkin rash. So how frequent you are changing diaper. Negligence also present. If bruises presentation, then ask about onset and the site, where it exactly, is it single or multiple, color, old or new, any bleeding from any other orifice. Ask about the sign of anemia like heart racing, pallor, indicate hemodynamically instability. So if there is bruises, ask about the onset and the site, where it exactly, is it single or multiple, color, old or new, any bleeding from any other orifice. Ask about the sign of anemia like heart racing and pallor, indicate hemodynamical instability. Now, if the chief complaint is fracture, so ask about the nature, is it open or closed? So fracture is open or closed, any bleeding, onset, first time or recurrent. Do you have any idea how he got this injury? Any video record? When you ask for medical video, does he move all his limb freely? Any abnormal movement, any torn frenulum, any eye discoloration, bluish, red or pallor, any nasal discharge or watery ear discharge, sign of any basal skull fracture. So fracture chief complaints we are asking, like ask about the nature, is it open or closed, any bleeding, onset, first time or current. Do you have any idea how he got this injury? Any video record? When you asked for medical advice, does he move all his limb freely? Any abnormal movement, any torn frenulum, any eye discoloration, bluish, red or pallor, any nasal discharge or watery ear discharge, sign of basal skull fracture. Now, musculoskeletal signs of any rickets like bowing leg, fallen teeth, chest rosaries, box-shaped head. So these are signs of rickets we will exclude, like bowing of the legs, fallen teeth, chest rosaries and box-shaped head. Muscle pain, skin lumps, neck swelling, size, mobile, red hot, painful, any neck swelling, hair, nail, lip swelling, hand swelling, peeling of the skin of the hand or feet, bone pain and joint swelling. Now general FWS fever. Is there any fever present or not? Unplanned weight loss, change in appetite, decreased activity, sleep disturbance, pain at night and morning stiffness. Other concern like dysmorphic features, long-term any medical condition or chronic illness. Very important, long-term any medical condition or chronic illness. So then if yes, all past history now, then systemic review we are asking urinary change in pee, like amount, color, frothy, frequency, pain, swelling in the private part, anyone measure blood pressure. So urinary change in the pee, anyone measure blood pressure, swelling in the private part, very important. GIT, tummy pain, tummy distensions, recent change in poo, mouth ulcers and cuts. CNS about headache, morning vomiting, facial asymmetry, curving of the back, unusual gait, unusual movement, mood change, eye deviations, unusual features in eyes, any concern about vision, hearing and speech. CVS about awareness of heartbeat, heart racing, intolerance to exercise, easy fatigability and blood pressure. Hematology about bleeding, bruising and recurrent bugs. Chest about difficult breathing, recurrent bugs and chest pain. Then endocrine as usual. Then we are going the past history. Past history is that very important 5TIOA. We know that history of any fall or trauma, because that is fracture, anything, history of any traveling history, previous admissions, previous fractures, is he taking vitamin D supplements? So is he taking vitamin D supplements because of rickets is one of the differential diagnosis. Parental history, any medical condition of medicines taken during pregnancy, screening for DDH, developmental dysplasia of the hip, any bone deformity that needed treatment. Then puberty only if relevant. Vaccination up to date, any extra vaccination. Allergy to medications or food. Nutrition is details, amount of milk in each feed, number of feeds, is he on exclusive breast milk, who prepare for him the food, type of food he is receiving, if any change in weight growth chart. So diet is very important, nutrition, because rickets is one of the DD. Then development, like in details, 4 domains, loss of any skills. Okay, then family history of similar conditions, consanguinity, family dynamics, age of the parents, does anyone of the family register in the social services, anyone receiving alcohol or drugs, social access to hospital, income, financial issues, any insurance, home is old or new home, aeration and sun exposure, who is helping you to take care of him, school type, absence and performance, psychological impact, how does this condition affect the family. So differential diagnosis, we know, we can tell that NAI, non-accidental injury, our top. And if rickets, the features I will search like wrist or knee joints, head size, tummy distension, sun exposure, calcium and vitamin D supplementations. These are. Then neglect, how can we understand? Delay, they come in hospitals. Who take care of the child from that? Also neglect, like vaccination given not properly, like feeding not properly, like and the delay changing the napkin, delay changing the diaper. Okay. Then osteogenesis imperfecta, one of the DD, because of the bone deformity, hearing concern and device in the brain. Hearing concern, also eye color we can ask, blue color eye. Then immunodeficiency, also one of the DD, recurrent infections, failure to thrive, perianal and perioral rash. So recurrent infections we ask, from that immunodeficiency we are excluding. Recurrent infections, failure to thrive, perianal and perioral rash. This is all about non-accidental injury history. Thank you.